Hello, good evening. How are you? How are you today? Welcome to another session of Ask the Doctors. The time is 8 p.m. here in Nigeria. My name is Dr. Frederick Unuboha. I'm a licensed medical doctor. And for here, we dey break health topics down to make them as simple like ABC for you. I'll be the host of this program, and my co-host now Dr. Irobonose Osaze Israel. How are you? How you dey? Where you dey watch me from? How far? Oh yeah, let me know. Now for this program today, we wan talk about one very interesting topic. We wan talk about constipation because a lot of people don dey complain say, doctor, I no dey feel, I no understand wetin be constipation. Some go come hospital go tell you say, doctor, I get constipation. Dem no even know wetin constipation mean. So for this program today, we go break am down, explain some kind things for you wey you go understand, and few tips wey you fit do wey go help you in case true true you get constipation. But I wan beg you, share this video so that more people may dey come learn because we dey live for Facebook and we also dey live on YouTube. So anywhere you dey where you dey watch me right now, you are welcome. How many of you know wetin constipation mean? Do you know? You know true true wetin be constipation? Oh yeah, tell me. I dey get problem to connect to my. They tell us say um, we dey get problem to connect to Facebook. So the Facebook pages are having issues this evening. I don't know why the connection weren't able to stream. Wow, why now? Wetin happen? Why then disconnect us from Facebook? Hey, yeah. Um, let's see. Let's try again. Let's try again. So I dey try to see whether we fit connect for Facebook because the thing just show me now say e be like say Facebook people might not see am. But I go look for a way to send am to them, make them see. So wetin you understand by the meaning of constipation? Oh yeah, tell me. Let make I know wetin you understand by constipation. Oh yeah, let us go now. Hmm? If you know wetin constipation mean, ladies and men too gents, put am in the comment section. I dey see you, I dey see you, I dey see you. I dey see say you dey watch me right now. Let's go. Oh yeah now. Tell me. I dey wait for you. Tell me. Oh yeah, oh. I want share this stuff to the people wey dey for Facebook, I want share am so that maybe themselves fit join us. Watch. Yes, let's see. So now that one I want to do now. I want to try and see whether I can share the live session. Oh yeah, so tell me, where are you watching me from? Oh, share. Yeah, I can share it right now. Good. Let me share. Okay. Okay. Oh, they say we cannot stream to Facebook, but we can watch on YouTube. So people the way they watch me for YouTube, and tell me, what do you understand by the word constipation? Oh yeah, tell me now. Oh yeah, let's go. So tell me waiting you understand by the word constipation. Dr. Israel is in the house. Make I bring up Dr. Israel. Dr. Israel, good evening. How you day? Hello,
Good
Dr.
evening,
Israel. How you day?
happy Sunday. They fine. Happy Sunday to you when they watch us today.
Yes. Welcome, Dr. Israel. Thank you for joining. So before we continue, I just noticed say this live session we no fit stream on Facebook. I don't know why. So I don't share the link so that those way they see us right now on YouTube, fit share to other people, make them join us to watch us here. So we dey talk about constipation right now. And I dey ask you, wetin you understand by the word constipation? Break am down for me if you understand in the comment section. But nobody answer me. So I just say make I start, then Dr. Israel come join us. So constipation first for me, e just mean say you no fit go toilet like normal before. You no fit shit. We dey use pidgin English to make am easy make you understand. You no fit kaka, you no fit poo poo normally. E dey difficult. Normally you dey go, but e don come pass certain time now. You no fit come shit. E come hard. You come dey struggle. Come dey give you wahala. Na im be how we go sum am up. But make I allow Dr. Israel break am down again. Maybe e get extra definition wey go make you understand. Dr. Israel, over to you.
Okay, when we say constipation, na as Dr. Fred talk, mean say person wey no fit go toilet, wey no fit shit. And sometimes scientifically we go say if you no fit go toilet for at least 3 times in a week, na we dey call constipation. However, we know say everybody get the way wey dem take dey go toilet. And because we know say everybody get the way wey dem take dey go toilet, so if e come be say anything wey dey outside your normal way of going to toilet, e fit come become constipation. You know, some persons dem dey go toilet every day. Some persons dem dey go toilet every once in 2 days. Some persons dey go toilet maybe twice a day sef. So e depends. But when you wey dey go toilet every day, you no come go toilet again for one day, 2 days, dat still fit become constipation. But as I said, scientifically we say person wey no fit go toilet at least within 3 times in a week, dat person don dey get constipation. And also, if you go toilet, your shit come dey very strong to the ex ten t say you no dey fit shit, the shit no dey gree come out, dat one na still constipation. You go toilet even when you still dey try go toilet every day o, but the shit come dey strong that if you dey shit, e go dey pain you, or you go dey get many issues before e fit come out. Dat one na still wetin dem dey call constipation. So Dr. Fred.
Thank you so much, Dr. Israel. Now, people wey dey for YouTube, I dey see say some comments dey, but e no dey show for here. No worry, we go try work am out. I no know wetin dey happen to this thing today. But somebody dey talk say constipation na inability for food to digest. No, you no get am, Mr. Gabriel. Gabriel Tava. You no get am. Dr. Israel don break am down. I don tell you say constipation fit happen to anybody. People no even know say constipation fit do old, e fit do young. No be say na elderly people sickness, e can do everybody. But one thing wey I notice be say most people dey complain about this problem and they no know why. So today, may we enter quickly. Wetin dey cause constipation, Dr. Israel? Why be say somebody go just dey now, come tell you say, the way wey I dey go toilet, e don come cast o. I no dey go like before o. Normally, na every day when I wake up, I dey go toilet. Normally, na every two days, now I dey go toilet. But now, e don enter 3 days, 4 days, 5 days, I never fit go toilet. Doctor, wetin be the problem? So make we break am down, so that people go understand. Dr. Israel, over to you.
Okay, when we talk about the causes of constipation, things wey go cause constipation. One na people wey no dey eat many food wey contain a lot of vegetables and a lot of fruits. When we say a lot of vegetable, food wey contain a lot of fibers, because those fibers dey help your belle dey move well well, dey make go make you go toilet well well. So people wey no dey eat enough of it, dey fit get constipation. Another one na you no dey drink water, so you come dey dehydrated. E get some people dem no just dey drink water at all. So those kind of people still fit get constipation, because wetin water dey do is that when you drink water, the water go come go your large intestine, and those water go still help sof ten your stool. When e don help sof ten your stool, you go come fit go toilet well. Remember when I talk say constipation still mean say your shit don strong well well. So you need water to take sof ten am. So for those people wey no dey drink too many water, yes, dem fit still get constipation. Another one na you no dey do exercise. People wey no dey get enough exercise, dem fit still get constipation. Stress fit cause constipation as well. And you come be people wey dey hold shit well well. Instead of you to go toilet, you wan go, you go dey hold am, dey hold am, dey hold am. E fit come lead to constipation later later, so that when you even want come go the first time to even go toilet, you notice say your belle come dey pain you, you no even fit quick shit the shit on time. So when you dey hold your shit well well, e fit still cause constipation. Then e get some kind of medications wey we go take. All those medication fit still cause constipation. All those strong painkiller medication, um antidepressant, some psychotic drug, all those one fit still cause constipation. So it also get some medical conditions wey fit cause constipation, and one of dem of dis medical condition, or sometimes some of dem na good condition, no be say all of dem na bad condition, because the first one wey I go mention na good condition. So pregnancy fit still cause constipation. Now the reason why pregnancy dey cause constipation because of the hormones. Sometimes dis hormone wey dey produce for the body fit help cause constipation, and also it depends on how the baby still take sit down for the womb. The baby fit even squeeze the intestine to some ex ten t, when e come be say the person no go fit pass through. When I mean the baby squeeze the intestine, no mean say the baby go come out come squeeze the intestine. From the womb wey the baby dey, e get how e go take stress im body, e go apply pressure to the intestine, and that one fit still cause little constipation. So there get some conditions wey fit cause constipation. We have some endocrine conditions, something like diabetes fit cause am, hypothyroidism fit cause am, hypokalemia fit cause constipation. So when people no get enough of calcium for their body, when we say hypothyroidism, all those people wey dey get problem with their thyroid gland, dem fit get am. So people wey get colorectal cancer, cancer of the colon, that is the cancer of the intestine and cancer of the rectum, dem fit still get constipation. Now anybody wey get intestinal obstruction, whether obstruction or complete obstruction. When we say pseudo obstruction, e mean say e no too obstruct well well, but na due to movement of the intestine. E mean say the intestine no dey fit move well well, na im be na im dey cause pseudo obstruction. So when the person get pseudo obstruction, the intestine no
Mm.
dey move well, e fit lead to intestinal obstruction. Then another one na e fit lead to constipation. Now intestinal obstruction fit still cause constipation as well. Then we get some neurological issues wey fit still cause constipation, like spinal cord injury and all that. All those one fit cause constipation. Okay, so these are na just some of the things wey I fit mention wey go cause constipation. Dr. Fred.
Hey, Dr. Israel network don comot. Now, if you dey see me, you dey welcome. I dey try to know. I don't know wetin happen today to this network. The network just dey somehow. So you wey dey comment for YouTube now, I just want you to drop in the comment section. Make I see true whether I go fit even see your comment. But Dr. Israel don tell us some of the things wey dey cause constipation. One very important one na wetin we dey chop. You go notice say some people go tell you, say, doctor, I don chop, I no dey drink water. You dey chop, you no dey drink water. Dat water wey you no dey drink go make your poo poo hard well well. And when your poo poo hard, you come go toilet, you go come dey cry. E go be like say dem dey beat you inside toilet. And if care is not taken, sometimes e fit tear. E get how person go go toilet, go poo poo, go come get injury, come get wound for that area when e tear. So that one na one thing. Then the kind food wey people dey chop. Then one other thing again, I no know whether Dr. Israel mention am, na concerning lifestyle, like exercise. Dr. Israel is back. Like exercise. Exercise fit also help you, because a lot of people know the exercise, and when you exercise, you dey also stimulate your intestine area, make e dey move. Then I don't know whether you get one thing wey Dr. Israel mention, na diabetes, because e get some people when dem get
Dr.
diabetes, that
Fred,
is their blood sugar is very high. Alpha.
I bin no dey hear you. I dey hear you now. Okay, I no know. How many persons dey hear me? I hope my network no first break for road. So I think I don mention some of the things wey dey cause wey fit cause wey fit cause constipation. If maybe you no hear me before, I mention medications. I mention some medication like some strong pain relief wey we dey take, like even diclofenac. If we take am too much, dey fit cause constipation. I mention antidepressant, antipsychotic, most of even all those drug wey we take wey dey stop vomiting and nausea. Some of dem fit still cause constipation. Den I come mention some medical condition, and I also mention sey pregnancy na one of the thing wey fit cause constipation due to hormones. And apart from pregnancy, I mention some endocrine condition like diabetes, hypothyroidism. When we say hypothyroidism, person get problem with the thyroid gland, diabetes, the sugar level dey high for blood. I mention those ones. Den I come still mention pseudo intestinal obstruction, when e be sey the intestine no dey move well. When the intestine no dey move well, e go fit lead to constipation, because the stool, because e no dey move well, those stool go dey gather, dey gather, dey gather, and because dey don gather, dey fit come water go dry comot, dey go come strong, and e go come lead to constipation. So I mention dat. Den I come mention intestinal obstruction, dat one fit still cause constipation. Den I now say some neurological conditions, such as when you get injury to your spinal cord. So because when you get injury to the spinal cord, e go actually some of dem fit affect the way wey you take dey go toilet. Now we get the one wey we dey call lazy bowel syndrome. So dat one fit still cause constipation. Sorry, I dey always talk intestinal obstruction. Dat one fit still cause constipation. So dis one na the things, most of the things wey fit cause constipation. So if you just dey join us, we dey talk about the causes of constipation. And remember sey all the time when we dey here na from 8 p.m. to 9 p.m. We no dey add no African time. And also for you to remember to share dis live session, so dat other people go learn wetin you dey learn, and so dat other people go also come ask questions. So if you get questions, dey gather dem wait, because time go soon reach when you go ask your question. Remember, wetin we dey talk today na causes of constipation, and we no go answer any question outside dis topic for today. So if you dey understand wetin we don dey talk since, abeg drop am for the comment section sey you dey understand and you dey follow us. Quickly, make we drop am for the comment section. So try share dis live, and also like our page. E dey very important. Those are na the only way wey you go fit take help us, and when you fit take support dis good work when we dey do. Remember, and the only thing wey we dey do for here na to educate, and not to prescribe or treat anybody for dis place. Dr. Fred.
Dr. Israel, how far? Can you? Yeah, how far? Can you hear me now?
Very well.
How far? You dey hear me now?
Very well.
Can you hear me?
Yes, I can hear you. I can hear you.
About how we go fit take know when person get constipation, wetin be the diagnosis? Continue. My network is messing up today. I don't know why. Hmm? And please continue.
I dey hear you clearly. We dey hear you clearly. Okay, maybe na Dr. Fred no dey hear us, but I know say we dey hear am clearly. Okay, now make we come look about the symptoms of constipation. How person fit take know say yes, e be like say na constipation na e don dey get. Now note dis one is that anything wey we talk here no really mean say na is 100% compulsory, say because you see dis, you fit just say na constipation I don get. But it's a sign. It's things that can push you to let you know say okay, it don reach time make I either see my doctor, or make I other do some other things wey go help me wey go help me go toilet very well. Remember another causes when I talk now, those people wey dey stay toilet, they not wey dey hold their shit, they no wan go to toilet, and they will just hold am for a very long time. Now, wetin be the signs and symptoms? Wetin be the symptoms when person go dey see wey go know say yes, im don dey get constipation or e get constipation? You go notice say e shit come strong well well, the shit strong well well and the shit dry. And also sometimes if the shit dey come out, e dey come out in small small lump. E dey come out kpoin kpoin. Sometimes e go be like goat shit small small, or sometimes e go big pass like that. E go dey come out in a lump, and e go dey dry. So when you just dey see that one, that na one way to take dey know say e be like say I get constipation. Another one na e go dey very difficult for you to even pass the shit. E go dey difficult for you to shit, and sometimes no be only difficult, you go come dey get pain. You wan shit, you go dey feel pain as you dey try push yourself make the shit come out. You go dey get pain. So you go notice say e dey difficult, and you dey push, you come dey notice pain. Another one say you come dey get stomach pain. Your belle go dey pain you, or sometimes you dey get cramps for your belle because you no fit go, you no fit shit. Sometimes you go notice say your belle go dey bloated. You be like say hair full inside your belle. When you knack am, e dey make kpo kpo kpo. Or you come dey feel like say you wan vomit, you dey nauseated. Or some person sef fit even vomit when they no fit go toilet for a very very long time. And another one na be say you come dey feel say you no empty your bowel. You go toilet but you notice for inside your body say the shit e no finish. So when you don dey notice all those ones as well, it's also a sign say yes constipation na I get so. So when you notice say your shit dey strong well well, you dey go toilet, e dey very painful, e dey very painful, or you dey push yourself well well before one small one go come down kpoin. Or your belle go dey pain you, or you dey get cramps. So when you dey notice all these things, know say na constipation na this person don dey get. So when we look at the risk factors, some of the risk factors na be wetin we don first talk of, the causes of constipation. But one when I go talk na age. Remember Dr. Fred say constipation fit affect anybody, which is true. Yes, constipation fit affect anybody. But for those wey dey the age of 65 and above, they still get high risk of having constipation. This one na because you know say their body don dey old, all the part of their body, even their system don dey old. So their system no go fit dey do work as e dey do work when they dey young. So old people dey get constipation well well pass young person. But that one no mean say anybody no go fit get constipation. Another one na if you know say they say you be female from birth, female from birth, na be say as they born you, they call you female, you still dey prone to having constipation. Why? Because of the hormones, and you know say you go still become pregnant. So because of that, your hormones also contribute to wetin go make you to get constipation on time. And also another one na for those people wey no dey eat food wey contain a lot of fibers, when I eat food, many fruits, you know, they take a lot of fruits, you know, they eat food wey contain a lot of fibers, food like vegetables, and you know, they eat a lot of vegetables, and you know, they drink a lot of water. So people when they take a lot of water, those are risk factor for them to become to get constipation. So all those people wey no dey eat that, but they eat a lot of fatty food, sometimes a lot of processed carbohydrate food like bread, and come dey drink a lot of garri, like say na take a lot of garri. So then when you wan even take the garri, you just carry only garri put for mouth, you no put water, you no do anything. So all those can lead to constipation. And you come dey take some kind of medication. Remember say we mention some medications that can actually cause constipation. So when you dey take all this medication, just dey get ready say constipation fit come. But there are other things wey you need to do wey fit prevent this constipation. So before we enter those things wey we need to do to take prevent constipation, I wan find out, una dey hear me or una no dey hear me? If you dey hear me, abeg put for the comment section say you dey hear me. And if you dey understand me, also put for the comment section say you dey understand me. Then if you get questions, As I said, as I said, arrange your question down so that we go answer your question for you. Abeg if you dey hear me, put am for the comment section so that I go know say you dey hear me. Dr. Fred, I dey hear you very well. I don't know why you do not dey hear me. Okay, okay, okay. I get it. So so how we go take get the questions if they ask questions? Okay, so So also I go also want to say for as many persons when they hear us, try and share this live session. We they always they talk that. And remember, say our topic for today now causes of constipation. In fact, we use the opportunity to discuss the whole of constipation, everything where we go fit tell you about constipation. So remember, say your question will still be within the line this of constipation. So not ask any question outside constipation. And even when you dey ask on constipation, please no come ask us for medication when we go give you, because for here we no dey prescribe medication. We be licensed medical doctor and we like our license so much. So we no go do anything wey go jeopardize our license and we as well. So wetin be ways when we fit take manage or So wetin be ways wey we fit take prevent or treat dis constipation? Now when we talk about treatment of constipation, you know say na only when something don do person na e dey take care of am. So dis some things wey I go mention na still the ways wey you go fit even use take prevent constipation. Because if you dey do most of dis things, constipation no go even hold, e no go even come. But if constipation come, if you still do dis things, dis constipation go still go. Before I talk dis thing, I go tell you one small story wey happen. I remember one time when dey complain to me say my grandfather no dey go toilet, e no dey shit. E mean say e get constipation. Say for days now e never go toilet. I was okay. So when I see my grandfather, I remember say then we get one orange tree for our front. So I climb tree and I plucked a lot of orange. Now I give old man make e lick. After e lick like 5, 6 orange, nobody dat complain wey dey talk, e disappear because after den e start to dey go toilet very well. So one of the things wey when we go fit take prevent or when we fit take treat constipation na to eat a lot of fruits and take a lot of food wey contain fibers. Food like taking of oranges, watermelon, eating vegetables, because all dis one contain fiber. And when we say eating of orange, we no mean say just lick only the water wey dey the orange throway am. No, eat the inside. Na dat inside na really be the fibers. So eat the inside. When you eat a lot of dat and take a lot of other watermelon, then chop a lot of vegetable fruit, other vegetables, dat one go prevent constipation, and also if you already get constipation, e go still fit help to treat some constipation. And apart from dat, drinking a lot of water go still help to treat constipation, because remember I say one of the thing wey dey cause constipation na dehydration. People wey no dey take a lot of water, and wetin dey happen is that when the stool don gather, water when you drink na suppose go help sof ten am so that when you make you fit pass the stool, make you fit shit. But when you no come take a lot of water and the small water wey dey there, the body don take am comot, the shit go come dey dry and strong. So when you take a lot of water, dat go help to reduce dat. And also you go need to avoid a lot of processed and fatty food. Food wey contain a lot of fat, you go need to avoid dem. Then fried food, processed meat, all those things you go need to avoid dem for the meantime. Another thing is that you go need to keep food diary. When we say food diary, food wey you know say you go dey eat food, dey keep some of those diary, dey find out which food dey really cause constipation for me. so that when you know the food wey dey cause constipation for you, you can easily decide not to take that food again, or always eat a little of those food. Some people when they eat a lot of bread, they go get constipation. So that kind of person, we go actually tell you say you fit reduce to dey eat bread, or if you wan eat bread, chook am for inside tea or inside water so that e go soft before you eat am. Some people if dem eat a lot of garri, they go fit get constipation. So that kind of person, we go also advise say no dey eat a lot of garri. And we know say some people like garri well well, so but we go still advise say when you notice say those food fit cause constipation for you, you need to reduce to dey eat dem. Another thing na be say you need to dey do exercise, because exercise go still help to reduce constipation. Then you go need to avoid to dey hold your stool. So those of us wey no wan go toilet go hold the stool for a very long time, we say e go cause constipation. So one way to take stop that na to avoid am, so that once you feel like say you wan go toilet, quickly go. And when you dey do am like that, those stool no go gather for there come block your sigmoid colon, or come gather for there say water come dry comot, come cause constipation. And another thing is that when you even dey toilet, the way when you take sit down for the toilet fit still help you. If you raise your knee up, like you come squat for the squat, squatting for toilet fit help you, fit help to reduce constipation, or fit still help to stop constipation. Now there are some medications wey you fit take to help to help constipation, and there are surgeries wey you fit still do to take stop constipation. Maybe mostly when you have fecal impaction. When we say fecal impaction, we mean say the stool don gather for the anus, come gather for the rectum, come cover some part of the intestine. E come mean say that one sef you no go fit shit am come out. So when you no fit do all those ones, sometimes if they even try to do enema, when we say enema, they try to pump something enter the inside your nyash make the stool come out. Sometimes if they no even fit do that one, maybe they do that one, the stool still gather many, you may be forced to do surgery to remove all those many things. And others dey fit even lead to intestinal obstruction. So to avoid all those things, surgery fit take place. So wetin be the complications wey fit happen if person get constipation? Now I go wan talk those ones, but I go also remind you say if you get question, start to dey drop your question, because after this we go start to dey take question. Dr. Fred, you still dey hear me? Hello, Dr. Fred. Okay. So wetin be the complications for constipation? When we talk about complication, wetin constipation fit cause? One, e fit cause wetin we dey call pie, that's hemorrhoid. E fit cause am, because when the stool don gather for there, e go make the blood vessels, the vein wey dey your anus, e go make dem come dey enlarge. So e fit cause pie. E fit cause wetin we dey call anal fixtures. When we say anal fixture, e mean say tear, you fit get tear for your anus when you dey try to push yourself make that strong shit come out. You fit mistakenly come got tear for that place. And when you tear come dey there, you know wetin go follow? Pain go follow. Sometimes you go come dey see blood for your stool. And another thing is that infection fit come even join am as well. Then another complication na when we dey call fecal impassion. I first talk that one before. Somebody fit come get fecal impaction. So these are na some of the complications when constipation fit cause. E be like rhyme. Complication when constipation fit cause. So when all these things don dey happen, now there are some other treatment wey we fit do for all these things so that make dem for stop. So these are na some of the full stories wey we get about constipation today. Now there are so many ways wey we fit take find out if person get constipation. You fit do some investigation, do some test. And all these tests wey you dey do, and all this investigation wey you dey do, test, scan wey you go do, no be just to know only for the constipation, na to know wetin be the reason why this person get constipation. Because remember I say some cancer fit cause constipation. Remember I say hypothyroidism fit cause constipation. So sometimes all this investigation wey we wan do, not just to know about the constipation, na to know why this constipation dey happen. This one na for you to know say constipation no just be disease. Constipation no be disease of its own. Constipation na sometimes na sign of another disease. Constipation fit become sign of another disease. So some people wey dey get colorectal cancer, dem fit get constipation. So e mean say na the colorectal cancer na im dey cause the constipation. So on those colorectal cancer, e fit be say the person go get constipation, after some time you come get diarrhea, you see am like that like that. So you go wan find out. So there are so many questions wey your doctor go ask you. That's why when you get any condition, we go always say go and meet your doctor. So there are so many questions wey your doctor go ask you, go ask you, go ask you. And this question go come make dem know why this person dey get constipation. E fit be say this person get e fit get colorectal cancer. E fit be say e get lazy intestinal intestinal, yes. E fit be say this person dey get pseudo intestinal obstruction. Wetin dey cause all those things? E fit be say e get some endocrine problem like hypothyroidism. So these are dem go ask you question about that, about your lifestyle, about how you take dey eat food, and every other condition, every other things wey the doctor feel like asking. Then from there, e go come tell you make you go do some test, some blood test. Those one fit come help to know whether you get too many sugar for your body, diabetes. Fit help us to know if you get problem with your thyroid gland. Then dey go come tell you to do some scan. Those scan like CT scan, MRI, all those one na im go come see point out or wetin Dr. Fred, help me out. Endoscope, colonoscope, yes, colonoscope. Those one go also help us to see inside your rectum, inside your intestine, all those side, to find out if there's any problem there wey dey make you dey get constipation. So when we don find all those things, then we go come treat you based on those things wey we see. And if dey treat you based on those things, most of the time the constipation go also stop. But if na wetin food and all those things cause, once you fit do all those diet when I talk, all those preventive things when I first talk, the constipation will actually stop. So Dr. Fred, any question for your end so that may we answer the questions? Now, I've been taking some medication, but it's for constipation, but it's still the constipation is still there. Remember, we talk so many things when I say it fit cause constipation. It's not just by taking medication for constipation. Sometimes, if you not treat those things when they cause the constipation, no matter a lot of medicine when you take for constipation, the constipation go still dey there. It means say, yes, you feel dey relief for some time, but after you stop the medication, the constipation go come. Why? Because wetin dey cause the constipation, you never handle that condition. So if e be say you no dey eat fruit, you no dey drink many water, you no dey eat food containing fibers, you no dey do all those things, and you dey very stressed, you no dey do exercise, you no dey do all those things, and you just go dey take only medication. If you stop all those medication and you are not eating those things, the constipation go still come, and then you go still go back, go take many medication. So that is why for you, I go advise you make you go see doctor. Make you go see doctor. Apart from those things when I mentioned, you remember I say I thought say some condition dey wey fit cause am. So that make dem find out, is there any condition wey dey cause this my constipation? So that if there's any condition, make dem for treat those condition. So that if dem treat those condition, then the constipation go actually stop. Remember say some medication sef fit still cause constipation. Some medication wey we dey take. So you still need even some antihypertensive wey we dey take fit cause constipation. So you need to know all these things so that when you dey talk to your doctor is putting you through and letting you know, oh, this because of this, na im make this thing dey happen, then they will be able to treat you very well. Not just to go pharmacy or go chemist, go dey buy medicine, say you wan buy medicine for purge or you wan buy this and this. No, it's not just to do that. You need to go hospital so that make dem answer you, check you and know the reason why you actually dey get constipation, then treat that and then you will be fine. Dr. Fred, any other question?
Alpha, can you see me?
Yes, I can see you.
Oh, you can see me. Thank you, Jesus. Thank God, thank God. Finally. Okay, so I can't see the other comments. I can't see the questions coming in. I don't know why. I'm trying to see if it's unique. Okay, so I can't see all the questions coming in. Me, I don't know why they come. But you don't talk about this thing. Going to the hospital for somebody. Now, person will get a hand. This is very important one. Somebody will get cancer, can't get constipation. I beg, more just talk about them. How make this person waka go? Because most time people they fear say, my constipation don't dey for very long. Go, waiting I go do. If this person get cancer, waiting go be the advice where you go tell this person.
Now, if the person get cancer, the best advice na to go hospital because they get doctors wey dey treat
Hello, Dr.
cancer,
Israel.
wey dey
Yeah.
manage cancer. Yeah, they get doctors wey dey manage cancer, wey dey treat cancer. So if person don maybe na when they don know the cause, come be say na cancer, mostly colorectal cancer. Remember when I talk about colorectal cancer, I mention say the person go get constipation and after sometimes e fit come get diarrhea. You notice all these things. Or sometimes another one na the shit dey be like goat shit. These are na some signs when you fit take know all those things. So when you come go hospital and they come find out say na cancer, there are things when the doctors go do for you. And it can't depend on the stage of that cancer. Now they go take manage you. Na dem go take manage you. And e get some other thing wey dem do. Dey get sometimes dem fit even tell you say, oh, you fit not go toilet through your anus again. Dem go bring out some things come out from your belle na through there your shit go dey come out. It depends on wetin the doctor see. Na the doctor go take know wetin e go do for you. But the best thing to tell you na no fear because no be you start am. So no fear. Is for you to first of all go, because if you don fit manage yourself, you don fit treat yourself, the tendency of you to live longer is there than when you no go manage yourself, you no go treat yourself at all. So that's why it is very good say when you don dey find out this kind of things, constipation, come see say maybe na you no even know whether na cancer, because until your doctor tell you, now you go fit even know. You need to go to the hospital. They go run some investigation, do some tests for you, try. E not cheap oo, e go dey expensive, but you need to do all this investigation for them to find out wetin really dey happen. And then when they don know am, they go fit treat you based on wetin dey happen to you. Dr. Fred.
Yeah, thank you so much, Dr. Israel. So anybody waiting in that state, my advice to you now say, no give up, no fear, no panic. The earlier you go to the hospital, the earlier they check you, the earlier they know what happen, the quicker they go fit help you. But when you can't stay for house, you think on the waka, on the spread. If it cause you more problems later in the future. Now, because of this network issue, Dr. Israel, I don't know that you get any final words because the network they show me shake it badly today.
Okay, the only my final word for today now to I can say we not really get too many questions today, and network no dey smile with Dr. Fred as well today. So I go wan say make we take care of ourselves. Yes, Christmas now few days from today. So Merry Christmas to you and Happy New Year in advance. So as you dey celebrate this Christmas, as you dey prepare to celebrate this Christmas and to celebrate New Year, need you to take care of yourself. Don't be in haste in anything you do. Try to dey careful. If person jam you, try waka leave the person, because you never can tell the state of mind of that person. And also, please take care of your mental health. Also, remember say everywhere dey very harsh this period. The weather is harsh for us wey dey Nigeria. The weather is harsh, so try to dey take a lot of water this period. And if you be person wey you get a lot of allergy, e go dey very nice for those asthmatic patients. E go dey very good for you to dey with your inhaler 247. If you fit wan put on face mask, abeg put on face mask, because this period many people go fit get upper respiratory tract infection. So that's why we say take a lot of fluid, drink a lot of water this period, and keep yourself warm. Keep yourself warm. And remember say all the things wey we dey do for here na just to educate you, and for you to remember to see your doctor at when due. At when due. Dr. Fred. Dr.
Yeah,
Fred.
thank you so much, Dr. Israel. Thank you for watching. Thank you for listening. Apologies, say the network. You dey hear me now?
Yes.